welcome back to my channel. My name is Appa in case you guys are new here, and today I have another nursing video for you. Finally, after a really long time, I got the chance to do my research, to present to you the information, and also just give you an insight from my personal experience as to what the difference between a primary care versus an acute care specialty is. If you have been on my channel, you guys know that I like covering these types of topics. Please just let me know down in the comments below what else interests you. I will be more than happy to do these videos. I know I have a couple of other items or other topics listed in my notebook. I did do a poll here on my channel just to ask you guys what you wanted to see, and this was one of the most popular ones, and I will get to the other topics as well. It's just a matter of time, and I do start school at the end of this month, so that's that as well. Please excuse my hair. I know it's like blowing in one direction. It's because it's just hot. It's Northeast Ohio, it's hot. We are seeing one of those really high temperatures. Even though it rained today, it's still feels like it's really hot. And yeah, I'm not a big fan of summer, in case you didn't know. All right, you guys, so one of the things which I have known and have learned just through my own research is that physicians and I can't really speak for physician assistants, but I can speak for physicians because, and actually this is not just in the United States, I feel like this is in other countries as well, is that they get trained in specific specialties and they have really long trainings, and it's a lot harder to switch specialties. And I can say this because I come from a family of physicians, so I know that this is an actual thing, and we need people who are very specialized in these particular regions. We need general surgeons, we need primary care doctors, we need a gynecologist, we need people in specific specialties for sure. But in nurse practitioners, I feel like even though they are trained in a particular area, moving around for them, let's say if they didn't like a particular specialty, moving around for them is a lot easier than it is for physicians. Physician assistant, from my understanding, correct me if I'm wrong, they do have a 2-year training programs at medical school. I, however, don't think they are trained in specific regions, like specific specialties. I don't think PAs have specific specialties. They are trained intensely clinically, I know that, but they kind of cover all age groups, and they don't always just focus on a particular specialty. I feel like they do focus on the specialty when they're actually on the job in the long run, if I'm making any sense, but their schooling doesn't necessarily do that. I think that's one of the main differences between the three different career fields, which I thought I should just put it out there because I think it's just important to know that. And yeah, hopefully that I'm making any sense. Let me know down in the comments if you have any questions about that, but hopefully I'm making some sense about that. So basically, I got some of this information from Purdue and their healthcare website. So they basically defined that nurse practitioners, they are very population focused. Their specialties are population focused. So they have family, adult gerontology, neonatal, women's health / gender specific, pediatrics, psych mental health. Now, when they say gender specific, I have never seen or have heard of a urology nurse practitioner. I have heard of family nurse practitioners or other providers working in a urology department, whether it's primary or acute care, but I've never heard that nurse practitioners just specialize in urology like they do in women's health. Hopefully that makes some sense. So basically, overall, what exactly is primary care, right? If you guys are not familiar with this term, basically it's referring to not just nurse practitioners, but also physicians, physician assistants, anyone who works in primary care. It basically means that it's comprehensive care. What exactly is comprehensive care? Well, it's more continuous. You see the same person, either on a monthly basis, every 2 weeks, whatever you're seeing them for. And it is characterized more as a long-term relationship rather than going to the ER where you see one doctor or NP, PA, whatever, and then you never see them again. So it's comprehensive. Chances are you might have the same doctor, obviously, for years and years. And, you know, one person might be seeing every single family member of yours. So that's kind of what primary care is, according to the website and according to my personal knowledge as well. That's what primary care is to me. Now there's something called urgent care, and I feel like urgent care kind of stops in the middle between primary and acute care. And the reason why I think it's kind of in the middle is because it's urgent, but it's not really like emergency that, oh my gosh, I need to be hospitalized for this. I think they created this area because there is an overcrowding of people with primary care problems going to the hospital and treating emergency rooms as, you know, primary care offices. It's urgent, but it's not really like life-threatening, if I'm making any sense. So that's why they are promoting like a lot of urgent care, and this is an area where you will see a lot of NPs and PAs working. A lot of urgent care areas are run by NPs and PAs mainly, and they either have a supervising one or two supervising physicians who maybe come in like once a week just because they kind of have to, because of, you know, state laws and things like that. So that is where you will see a lot of, you know, NPs and PAs, but of course you'll see them in primary care doctors' offices. You might even see nurse practitioners owning their own, you know, office, like a primary care office. I know in a lot of states where there is a high physician shortage, NPs do have the opportunity to do that. Practitioners can have their own clinics depending on the state, of course. And some of you have requested me to do a whole video on different state laws. I will get to it eventually, but this was the most requested video. So basically that's what primary care is overall. A lot of people who go into this field, they want a 9-to-5 job. They are more comfortable with that. They want to know what is coming into their clinic. They want to be aware of what types of patients they're going to see, whom they're going to see. So if you happen to be that type of person where you are very like, I need to know ahead of time and I want a office-like life, I think you are meant for this type of specialty. So a lot of specialties, for example, which will come under this primary care umbrella term would be, you know, family nurse practitioners, adult gerontology, primary care. They also have adult gerontology acute care, but that's more hospital focused, of course. And then also women's health or gender specific specialty. Pediatrics would also come under this umbrella term, and psych mental health as well. So that is primary care for you in a nutshell. Hopefully that made some sense. Moving on to acute care. Now when we think of acute care is basically when you need a lot of help. Like you need a lot of help in the sense that you will die outside the hospital if you don't get this help. You know what I mean? So that's pretty much what acute care is in my opinion and according to this website. Basically, according to this website, it says restorative care characterized by rapidly clinical conditionals. Some examples would be COPD, heart problems, uncontrolled diabetes, things like that, where you really just need emergent care. That's when acute care comes in. So a lot of the people who work in this field are specialized and trained to work with complex patients. They might see some psych patients, but mainly these patients, they tend to have medical problems. And if they do have like a psych person come in, it's always for patients who have medical problems and they're always having like some neurological issues as well, or they also are taking psych medication. So that's when psych would kind of come into acute care, is when they're having your neurological, my gosh, I cannot speak today, neurological issues. And of course, if they're taking psych medications, because there are a lot of interactions that can happen with heart medications with your psych medications. I should know the specifics, but I really have to review all of that. So basically, the type of person who wants to work in this field, I know the lighting's changing because it's raining. It's going to rain. Yeah, it's going to rain. Anyways, the type of person who is going to go into this field is going to be more someone who is able to work night shifts. That is 100%, especially if you are a PA and an NP, working with a team of doctors on a internal medicine floor. That's where you have to do night shifts, at least for the first couple of years of your career. I feel like you are going to have to do night shifts. Basically, what your role is in this hospital setting is that your role is mainly as a hospitalist. Sorry guys, I'm having to take so many breaks. I'm afraid that I'm gonna run out of battery on my camera, and I really should just explain it to you guys what I'm trying to say in simple terms. So basically, in acute care, a lot of NPs and PAs who work in acute care, their role is going to be that of a hospitalist. Now, what exactly is a hospitalist? Hospitalist is a physician trained in internal medicine who primarily works with, hospitalized patients. So you will see all sorts of patients from heart problems to neurology, etc., etc. You're kind of like the incoming person. So when a patient comes from the emergency room, then they're gonna be brought into a particular region, and you are going to be the first person to kind of assess them. Other than the nurse, of course, you will kind of be the first person to assess them, and then you're going to go interact with a specialty, call them and stuff like that. So that's kind of what a hospitalist does. A lot of old doctors would kind of call themselves the ward doctor, and I know in like the 80s and the 70s, ward was the term which was kind of used. And even like my dad, because so my dad is a surgeon. He's trained in general surgery, but during his training, obviously, he did a lot of hospital type of training. And even to this day, he himself says that he was never really cut out for primary care. So he also was a ward doctor, because he worked for a really small hospital where he kind of had to see a lot of different types of patients, and that's what he did a lot as well. So that's just hospital medicine, and a lot of people who work in this area, they don't really do primary care. Very rarely will you see a lot of people doing kind of both, and a lot of times they are either family doctors or family nurse practitioners. So with this career field, obviously you have to work nights, you have to work holidays. Unlike primary care, you will not have a 9 to 5 job. So it takes a special personality to do this type of work, and it is not cut out for everyone. That I can say. If you don't think you can handle patients dying on you, or like patients who are extremely sick, who are highly infectious, I don't think this specialty is meant for you. So this all just comes down to personality and the type of setting you want to deal with. I personally think that for me, and I think I've known this for a really long time, I am cut out to be more of an acute care nurse practitioner. A lot of my clinical instructors have told me that, but I am specializing with family because of certain circumstances. I'm not really able to do acute care, and you guys are thinking, well, why? Like, why? It's a lot more complicated because I am an international student, and at the graduate entry program that I'm in, I have to work in an ICU for 1 year before I can move on to the acute care program. But I, as an international student, can't really do that, and I'm not quite sure if I want to delay my, graduate education, because I feel like I already have a plan in my mind and I don't really want to change my specialty, not right now. I do have to formally declare my specialty at the end of this fall semester, so I don't think I'm going to change my mind, and it's because I feel like I can go into, acute care as a family nurse practitioner as well. According to my research and according to me just talking to other family nurse practitioners at other hospitals, I have learned that it is possible. It is difficult, to get into acute care, but it is definitely possible. One of the nurse practitioners that I talked to when I went to Minnesota, so actually I went to Minnesota and I visited Mayo Clinic. If you watch my vlog, you might notice that I am walking through the campus or driving through the campus of Mayo Clinic, and I did converse with an FNP who worked as a hospitalist and nurse practitioners as an FNP, and she basically told me that whether it's RN experience or whether it's like hospital experience as an NP student, either one should help you, get into the hospitalist role as a family nurse practitioner. So I am going to have like a hard time, I guess I should say, like in this field, like trying to decide or trying to get employed in a field of my interest, and I might not even get a job in a hospital right away as an FNP. There is a possibility, I know that, but I do have to do what my visa status allows me to do, so I do have to kind of work around that rather than pursuing my interest, which kind of sucks. But at the same time, as a family nurse practitioner, I have so many different opportunities. As a family nurse practitioner student, I should say, I am literally able to see all different age groups, and I am pretty sure the demand for FNPs at a smaller hospital might be higher because they're able to see all different age groups. So that is a topic for another day, you guys. Thank you so much, you guys, for watching. Hopefully this video kind of gave you an insight as to what the difference between the two terms are, two specialties are. And yeah, talk to you later. Bye, guys.